everyone. My name is Dr. Doug Pooley and I'm with C.A.R.E Chiropractic and Acupuncture. What I'm going to share with you today is what we would consider to be the next generation in chiropractic care. It's called a ProAdjuster, and what this does is it assesses the spine as well as provides a corrective adjustment, but it does so in a very non-threatening and non-aggressive fashion. So let me walk through it. What we're going to do first is we're going to use this implement, which is called the ProAdjuster head, and we're going to scan the spine. While doing this, we're using a science called piezoelectric. And what it is very much the same science that's used by NASA to check the integrity of the tiles in the bottom of the space shuttle. So it's very sensitive and very effective. What we're looking for here is we're looking for areas of blockage or resistance, because that's a measure of areas in the spine that perhaps aren't working as well as they should be. So let me show you what I mean. We're going to scan, this is Andrew, and we're going to scan Andrew, starting at the neck. And what it does is it creates an image on the screen. What this does is the computer picks up the impulses from the instrument, it digests them, it uses a baseline, and then what it does is it spits them out on the screen. So what you've got here is each one of these little green bars is actually representative of relative movement for the segments in Andrew's neck, starting at the base of the skull, going down here. Through computerization, it was determined that the baseline for effectiveness would be at or about 20. So if you're beyond that a lot, what you're going to get is that's a demonstration of resistance or more resistance. And if it's too shallow behind the 20, that also is a demonstration of hypermobility or too much movement, both of which can be an indication of spinal problems. Now in this case, as you can see, everything is at or behind the 20. What it does is it creates a nice little arc here, almost like a rainbow. Now Andrew doesn't experience a whole lot of pain in his neck, so as a result, this would be considered an exceptional scan. Now we're going to move to his mid-back. And here, it's interesting because what we're finding with Andrew, again, because we're lucky enough to have a conditioned athlete with us as a test client. But each one of these bars, again, representing relative movement in his back. What we've got is we've got excellent movement, but as we get down towards the lower portions of the spine, what we're noticing here is a little bit less of an image than what we would normally expect to see. This is a demonstration of a potential for hypermobility, or in his case, as I say, being a conditioned athlete. Now what I would do here, again, there's nothing to technically adjust. His spine is moving well. So let's move to the lumbar spine. Here in the low back, now here again, what we've got is essentially a good curve. As you can see, what it does is it demonstrates here as almost a clear rainbow. Where we would have a little bit of resistance perhaps is right up at L1. So for demonstration purposes, I'm just going to show you what an adjustment is and how it feels. What I did was I just adjusted L1. As you can see, this is a very non-aggressive approach. What we're doing is we're using what's called a high velocity, low amplitude thrust. And because the spine naturally wants to move, that's why we can do all these wonderful things. It doesn't take a lot of force to create movement. So let me show you what happens, because what we're going to do now is we're going to do a rescan of Andrew's spine to see what changes have occurred. And you can certainly see the change that occurred as a result of the adjustment. L1, which was the segment that we worked on, it changed function, so it reduced in intensity. And what it did was it changed also some of the other segments of the spine. Most notably, a little bit of a change here at L4. This demonstrates the fact that the spine is a totally mobile structure, so if you change function at one level, invariably it is going to change function at another. So what this is a demonstration of what a ProAdjuster is capable of, and as you can see, it's a very non-aggressive approach for patients, for example, who are severely arthritic or who have had experience with chiropractic in the past, physical chiropractic that maybe has been a little bit less than satisfactory. this is a very reasonable and science-based alternative that will provide great relief. The results are essentially equal to what would be done manually. And the nice thing is, again, with our clinic is that you not only, now you have two options. Manual chiropractic, which of course is very effective and safe, but as well you've got the ProAdjuster technology if you want something that's perhaps a little easier and a little bit less aggressive. Thanks.